I'm Dr. Stanley Charon, President of Nueva Salud. Central America is a region of contrasts. Visitors to Guatemala see Antigua, steeped in colonial charm. This 16th century town is a part of the modern world. There are paved streets, commerce, electricity, radio, television, sanitation, and modern health care. It's worlds apart from where we're going to go. Traveling from this 16th century town to the isolated indigenous villages is a trip into the 10th century. Crossing the Cuchumatanes Mountains by air takes only 40 minutes, but it's an 18-hour drive by pickup truck. On the north side of the 7,000 to 10,000 foot Cuchumatanes is an area of 2,000 to 4,000 foot mountains with scattered small indigenous villages linked by rocky, unpaved paths that run through rivers and ravines. Nueva Salud's pilot village, San Antonio de la Nueva Esperanza, lies in this region, populated by subsistence farmers. The people are Maya from several groups, Ixil, Quiche, and Quechua, each with its own language. Nowhere in the region does healthcare meet even the most minimal health standards. The mission of Nueva Salud is to create village-level healthcare systems that the villagers themselves can sustain. The landing strip at San Antonio is a pasture, and the houses are scattered around the hillsides along with farming plots and cattle. Here is where Nueva Salud is starting. My initial visit focused on getting to know the village and the people, and on evaluating the healthcare status and needs. Everywhere there are rivers and streams crisscrossing the paths running all through the village. In certain places, little hillocks are actually covering ancient Mayan ruins. Here I'm standing in front of a buried ancient temple platform. Most adults here are illiterate, but the middle school set up by Greg and Elaine Walton prepares kids for high school and to return to San Antonio able to maintain education, economy, and healthcare improvements that have been implemented. The agronomy program at the middle school teaches villagers to raise their vegetables on elevated platforms so they don't wash away in the rainy season, and to grow a much wider variety of foodstuffs, including tilapia in the puddles that are all over the village. Hogs instead of pigs. Ducks and geese. Honeybees that don't sting. Chickens that are big and fat enough to provide food. Rabbits, all efforts to widen their diet. This is the teacher's office in the school. The school is the only place where there's electricity and communication with the outside world. A lot of the kids hang out at the school as well as take their classes. Some Quechua girls have come to the middle school to sell their pineapples. Marlisa Clapp, my colleague, is buying them. On the other hand, this is the government-run elementary school. The paths are always full of activity. Women in their brilliant, beautiful clothes, always on the march, going from one place to another in a place where there's actually nowhere to go. The paths are full of kids playing, teenagers socializing, and the crops being brought back from the fields. A flirtation along the way. a load of firewood that'll last a day or two. Returning home weary after a long day. Once a month, there's a vaccination program for children under 5 and their mothers. A 6 or 7-year-old girl brings her brother. The government supplies the vaccination materials and a few medicines, and it pays the salary of a nurse, Jorge. A small group of minimally trained health promoters assist Jorge. The level of care they provide is spotty. Diagnoses are vague and unsupported by any technical data like lab or X-ray. With poor diagnoses, treatment is often misguided, and minor conditions escalate to major crises. Charming as the children are, they show evidence of stunted growth, indicating chronic malnutrition. Washing with soap and water happens only on laundry day. My first job was to evaluate the water supply. Underground springs feed a cistern high above the village, and from there, water is distributed to every house in the village. At each house is a characteristic 3-tub Guatemalan sink with clean running water. Clean water is a clear public health asset. The latrines are a disaster. Intestinal parasites and diarrhea are universal. Clearly, one of the first priorities is going to be building latrines that can be cleaned and beginning a hygiene education program. Women don't bathe. Instead, they have sweat baths in places like this. This is a typical house. Pigs, chickens, and dogs wander in and out. With each household consisting of 10 to 12 people, there are few eggs each day, but little meat available. This Ixil woman is well under 5 feet tall. Stunted growth is nearly universal here. This family has someone working in America who sends money back for a fancy house. Open fires are the rule, no matter what the structure of the house, and they fill the single room with smoke. Huge loads of increasingly scarce wood feed the fires. They clearly need fuel-efficient, ventilated stoves. Only one family has this kind of stove. For everybody else, there's the traditional open fire on a 3-stone hearth. The women and the children spend all of their days in these smoke-filled environments. There is clear documentation of the health effects of smoke pollution in these houses. The children have chronic respiratory and eye infections. The women have hypertension and produce low birth weight babies. Clearly, fuel-efficient ventilated stoves are going to be another top priority, one of the first things to do. In contrast, the volunteer teachers from all over the world who come to teach in the middle school stay in this facility. Each person has a little cubicle to sleep in, and there's a nice kitchen. Their health status is pretty good, except when they eat with the villagers. Then diarrhea becomes a problem. At the end of my visit, a young man packs up my bags and we make our way to the airstrip. Nueva Salud and the villagers have set up a hospitalization, public health, and primary care program. Our plan is to complete the pilot program and replicate it wherever indigenous villages are out of the reach of physicians. Funding has come from the Gunn Family Fund, the Conservation and Research Foundation, and the Guest Foundation, as well as from generous individuals. We're continuing to look for foundation and individual support wherever we can.